Digital acceleration is here. Health systems are walking the path, but are they in the right direction? Welcome to Patient Journey Pioneers, roadmaps from the top digital leaders in healthcare, who share insights and strategies that are pushing the patient journey to new heights. This podcast is brought to you by Hyro, and I'm your host, Liat Kozuch. Today we have a very special guest, who I was lucky enough to meet in person at Becker's this year, Craig Richardville, Chief Digital and Information Officer at Intermountain Healthcare. Craig, it's great to have you with us today.
Thank you. It's great to be here.
So, Craig, congrats on your most recent award, the 2021 National CIO of the Year, the Orby Award. You also won 2015 Chime CIO of the Year and 2017 CIO of the Year, and I can go on and on. You've also been nominated as a true thought leader by several of our previous guests on this show. So how does it feel in general?
Well, it's actually very humbling. I think probably the key for me is just loving what you do and just having fun at it. And we seem to be making an impact. So building a great quality team and putting them to task. And it's been a lot of fun.
It's a blessing to love what you do and do what you love. Craig, an interesting fact about you is that you actually had your own consulting company for innovative startups. In addition to all of your roles in the fields of tech, analytics, BI, and AI, machine learning. So let's backtrack and just have you briefly tell us about your journey in healthcare and how you got to where you are today.
Oh, yeah, great. So if you go back, you got to go back a few years, but I started my career at ProMedica Healthcare, which is just a fantastic organization based in the Midwest. My last couple of years there, we actually got into more entrepreneurial type of work. So they had a Vanguard Health Ventures, and I was part of that with a couple other really close friends of mine. And we ran really that organization, which was more on the for-profit side, for a couple of years, which was really fun. It was innovative. Then I got the opportunity to go down to Atrium Healthcare down in Charlotte, North Carolina, spent 21 years there, including being the Chief Information and Analytics Officer. And that was part of my journey that was great because when I got there, we were 3 hospitals. And when I left, we were 42.
Wow.
So I was in almost every size organization you can think of with many different types of relationships, from mergers to acquisitions to lease to manage. That really gave me a great perspective on how to network and manage relationships and really learn how to deal with different aspects of our industry. And then I had the opportunity then to come to SCL Health, faith-based organization. It was my first faith-based, so it really kind of brought you down to the mission of what we truly are here for. And that was really humbling and touching and just a nice aspect of healthcare that sometimes we lose. And then with the recent merger with Intermountain Healthcare, I've been very blessed to have been selected to be part of this new team, which is a fantastic organization that truly has a vision that is quite inspiring.
What's been the biggest learning experience during this whole merging of SCL Health and Intermountain?
Well, the biggest thing for me is truly you start to peel back the different onions of both organizations, and you realize that maybe in your organization you thought you maybe had some things at a certain level, and also in the new organization maybe things were thought to be at a different level. But as you continue to peel back, you start seeing where the opportunities are. The nice part is you really have the ability to bring that together and to change the organization in a very material way in a very short period of time. So we kind of started with some of the planning aspects as we were going through the negotiations and the talking that were happening at the highest level. Some of us really got engaged with some planning pieces. And as we started to plan and started to look to see where the opportunities were, the impact that you can make is quite measurable. So we're really going to have fun. Like, for example, within the first 30 days, we converted 20,000 of our caregivers from one platform to another platform, just kind of earth-shattering speed with a high level of success and preciseness, and continuing to grow the team to be confident to do more heavy lifting and really make the changes. So that part to me is really going to be over the next couple of years, just quite impactful and fun, really, for everybody.
Speaking of fun, more red tape, less red tape with this merger?
In terms of red tape and that kind of stuff, some of the processes we have in place, many of those are there for obviously a good reason. But when you look at the alignment of the organization and the new leadership that was put in place, really for us to march forward into look forward to the vision of the organization. This integration of our two to become one is really top of mind on everybody. So there's really no red tape or things that are holding you back. It's more of prioritization of the work, making sure that the resources that you have are there to support the operations that are there to deliver the care and promote health. So it's really one of those things that it's kind of like 1 + 1 = 3. It truly is that way.
A great synergy.
The thing that I have always instilled with my team is truly the need for speed to get things accomplished. And the nice thing about this integration, about this work, is bringing the two cultures together and some of the differences that we have, and really kind of reconciling those differences and taking the best of both to create what I would say would be the new culture of the organization, and certainly for my area of responsibilities. And one of them is the preciseness, but also speed. And sometimes to be precise, people kind of, the whole classic of analysis paralysis and admiring the problem. And you have to quickly make decisions. Then you have to execute against those decisions, while at the same time continuing to learn, be agile in your approach, but more things are becoming your way. The thing that you find out is the more successful you are in delivering your services, the more asks that come your way. And that's something that is quite, it's a gift, it's a pleasure. It doesn't mean that all of a sudden your plate is empty. More things start coming your way because of the ability of the team to execute. And that's the combined team. We're just one piece, of that. And when you look at the operations, the change management, all the things that come into play, the measurables that we have in terms of our performance board and our key performance indicators, all those different things will continue to have us focus and refocus and move forward with these kinds of changes. But from my standpoint, it is really plowing through this very quickly, because our intent is to continue to grow, continue to develop. So the things that I know that I have to do, I need to get those done, because there'll be other things that I can't even forecast or see right now that will be coming my way, and I need to create that capacity to get that accomplished.
You spoke about the 4 F's in a previous interview, and I loved that. Could elaborate on that for our audience as well, because that was, some insightful tips for other CIOs.
Yeah, so the 4 F's originally started as 3 F's from one of my mentors: to be fast, to be fluid, and to be flexible. And then as that kind of continued, another mentor of mine said, you should add a 4th F, which is to be focused. So we talked a little bit about speed. So be fast is certainly is the way to go. To be fluid, it's got to be smooth. They're not hard shifts and turns and ups and downs. It's really got to kind of start to flow and get people comfortable with that aspect of it. And then when you look at flexibility, things change. Our environments change. The people change, the missions change, the things outside of our control change. And we have to be able to adapt and be very agile with that. Then the focus thing is really to focus on the big things. Let's not make sure that, if you looked at some of the, like Covey's thing in the past, where he looked at putting in the big rocks and the medium rocks, you put in the sand, and then you put in, the water at the end. If we focus on that going backwards, we won't be able to work on the big stuff. Right. So it's really to be very focused to make sure we understand the 5, 6, 10, 12 big things that are going to have a material difference to our organization. There's always going to be all the other requests and the demand of your services coming into play. So to be very focused on that work and making sure that you are investing in those that have great returns for your patient quality, cost, outcomes, etc.
Speaking of focus, what is the most important project you're working on today at Intermountain when it comes to the digital patient experience?
Oh boy, great question. Because there's we are starting to become an industry, where digital is first, almost like a digital industry that delivers health and that delivers care. So that transition is big. We've seen it in banking. We've seen it in retail. We've seen it in all other aspects of our life. And now healthcare is primed for that. So really, it's kind of like not one big thing. It's a whole thing around digital. If I had to look at how we're looking at wanting to measure ourselves, I would say there's probably a few things. Let me name a couple. One is likelihood to recommend. That net promoter score is just critical to us. After they receive the experience from us, will they go back and recommend us to their families, their friends, somebody they run into, et cetera? And I think it's really important that piece kind of brings all these other components together, allows us to be able to understand that. There's a lot of leading indicators, lagging indicators, other measurements that you have to put into play, but truly at the end of the day, when they look at the experience, the quality, the cost of the service, which is the value equation, is taking experience and quality and dividing it by cost, will they recommend us? And that's a big thing for us. When you look at the pieces that we're doing, we're working on two focuses of the digital experience. One is that we'll look at our patient, that will look at our consumer, that will look at our member, whatever different hat that they're wearing externally. And how do we make it easy for them to access our care, to understand, to kind of put more of the tools into their hands? If you look at historically how we used to deposit a check, we'd go in, piece of paper, sign our name, walk into a branch, deposit it in, give it to a clerk, she would process it, and then we would walk out. Now you just take a picture with your phone. That's the type of difference that we need to have in healthcare, is really take all of the different historical ways of how we processed healthcare and process the delivery of healthcare and really make it very intuitive and easy to use. And a lot of that's going to be on the digital side. So that whole experience that we're looking at, moving the work from, like in the banking example, from the clerk over into the patient's hands. He or she wants to do that work. You want to do the work. I do. When I want to e-check in, when I want to do a refill, when I want to look for maybe some early diagnosis with some symptoms, let me pull out my phone at 3 a.m. and do that. That's how I can process my bills. So why can't I do that in healthcare? So that kind of shifting and changing in its way that other industries have done. In this case, we will be doing that, but also we'll be leading that. The last thing I really want to say on this topic is it's really important that we understand too, when we're looking at the digital experience and digital transformation, all that work, there is a equity issue within healthcare that we got to make sure that we solve. And part of that equity issue is the digital divide. Not everybody has access to the same things that maybe you and I have access to. So how can we take that same affordability, accessibility, great experience, high quality outcomes, and bring that to an environment that may not have the tools and the connectivity that some of us have, and put that all into play and make sure that we can either bring those tools to them or that we can morph our tools around to help them to be able to provide that access. And that's something that I think is critical for us to be successful. It's not just to treat those that have the ability to get treatment, but those that are the underserved, the poor, the vulnerable, and truly bring equity into healthcare.
You have spoken about the goal to become the Amazon of healthcare, right? And so providing that same consumer experience in healthcare, what makes it a bit harder in healthcare than in other industries to implement all of your visions?
Yeah, when you look at maybe how things have been legacy in healthcare, it's the industry has developed to be more provider focused in the past, and that has certainly changed over the last decade or so. But the early years, all the way through up till the last 10 years or so, it's really been very provider focused. So I'll give you a simple example: why are office hours from 8 to 5, right? Because that is typically easier for the provider. However, for me as a patient, that's the hardest time for me because I'm probably working during.
You want to go on at 3 a.m.
just as he or she is. That's right. So that's been all provider focused, and you're starting to see that shift to be patient focused. And that's where you started seeing urgent care centers come into play, now virtual coming into play, where really you have ubiquitous access 7/24 to a caregiver who can help resolve or to diagnose you, put you on the right plan, et cetera. And putting it kind of more of what's convenient for me into the example at 3 a.m, if that's what I need somebody at 3 a.m. to assist me in that process. I can buy a shirt at 3 a.m. Why can't I receive healthcare at 3 a.m? So you're starting to see that shift to take place. And the digital experience is really what kind of drives that shift to be more patient focused, more member focused, more consumer focused, really putting the hands and the tools into those different personas, that we defined, and bring that back into us. So really it's a transition that we are here to serve, and in order to be a servant, other people have to be the ones that are dictating how we move forward. And that's going to be our patients and our members to have it be that way. The one piece I do want to comment on is the whole aspect of healthcare. And historically, the financing of healthcare has been very focused upon the care side. You're sick, I take care of you. Well, that's on the health side. And so one of the visions of Intermountain Healthcare is to be the model of the future of healthcare within our industry, and to allow others then to follow, to allow us then to teach others so that they can continue to move forward with that. And that becomes more around value-based care, where we talked about at the beginning, making sure that it's accessible, it's affordable. You're taking the experience and the quality of the outcome, and you're dividing that by the cost to be able to create what the highest value is. And that's going to be the alignment of going at risk for clinically risk, financially risk, experience risk, and really making sure that, that for us to have the financing of healthcare, we have to deliver on all three of those components. And that's a big shift for our industry, which is still typically volume-based and focused on the care side. So as you move to the value-based care, my goal is to keep you healthy, to keep you well, give you the tools that you can do things at home, at your convenience, but still follow proper protocol, so I can send you nudges or reminders to go ahead and do something, or maybe not to do something when the opportunity is there, and really kind of help guide you along that. And what I would say, that becomes kind of the rhythm of life of what you do. So your behaviors and your tendencies. So you might get up in the morning, look at your phone, check your social media, maybe check some text, maybe glance through some personal and professional emails. Where is health in all of that? So what I want to be able to do is have you come up and say, hey, here was my sleeping, here is my nutritional, here's my workout routine I've got coming up today. And just kind of getting yourself prepared to keep yourself healthy and well, and or if you have a disease, how do you manage that chronic disease? And we have the ability to provide you those tools to keep you out of the most expensive care side of healthcare and keep you more on the healthy side of healthcare.
How is Intermountain becoming the model of the future? What tools are you using today to enable this access for patients? And how do you measure the success of this type of initiative?
This is where I think it becomes fun, because there's two sides of the equation. There's the patient or the member side, the customer, consumer side. And there's also the pay or the provider side, in terms of the physician, the caregiver, those that are actually delivering the service. And in many cases, obviously, there's a payer arm that kind of in between that coordinates between the two aspects of that on the financing side. However, the thing that I would say is the big difference for us, and the way that we're kind of moving toward is truly getting the engagement. So it's not only the experience, but it's the engagement of that patient, of that member, of that consumer involved. And that's going to be part of knowing who you are, being very personalized, not customized, but very personal for you. What are the different social determinants of health that you have? Do you have transportation? Do you have housing? What are the different aspects of your life that you have that I may or may not have that are going to be different? What are your behaviors or tendencies? Understanding that. If you look at healthcare, people will say that maybe 20, 30% of truly the length of life and the quality of life is revolved around medicine, revolves around the care. Things of your health behaviors, alcohol, diet, exercise, tobacco use, social and economic factors, that's those social determinants of health, whether your education, your employment, income, you have family support, et cetera, in your physical environment. Those are all other aspects of your life. So part of what we need to do is we need to understand what it is about you that allows us to be able to get you engaged in all aspects that will lead to having a long and high quality life. And that's going to be gathering data and information from different sources that we don't have it today. We talk a little bit about on the clinical side and interoperability and some of those things, which is absolutely critical. But again, that may be 20, 25% of the data that I need. And the other information is potentially more accessible, or should be accessible to me, to allow that. If you look at what you look at on the financial side, when somebody looks at you and gives you a credit score, they are able to look at many aspects of your financials, whether it's your income or whether it's your ability to pay, if you had any bankruptcy, are you late on making your payments, all your different aspects of your financial health go into play in order to give you that score. We need that same similar type of information within healthcare. your nutrition, your behaviors, et cetera, in order to say, what is special about you and how should I be treating you on the healthcare side of things? So access to data is going to be really important. And how do we digitally engage people to become part of that to help improve their overall health score?
We're going to play a fun game now, Craig. You're going to be placing your digital bets. I'm going to be naming a technology in healthcare, and then you're going to tell me if it's bullish or bearish. You ready?
Yep.
All right. Number 1, telehealth.
Bearish.
Why?
It's interesting. Many people would probably say bullish. And the reason why is I think telehealth, depending on the definition, needs to move to be online care. Telehealth, to me, the definition of it is connecting like me and you now. We're having a teleconference where there's 2 humans that are involved. And it reminds me of the banking example of me going through the little drive-through. And I would take my check and I'd put it in that pneumatic tube and send it over there. There's a clerk on the other side. But we don't do that today. We online bank. We don't telebank. So I think the definition of moving from telehealth to online health is really, I see as the transition where telehealth was a phase, hopefully a transition into online health or online care, where truly there's a machine and intelligence in the background that's processing and interacting and engaging with you. Not just a human on the other side where there's a thing connecting 2 people, but letting the machine do the work for you.
Okay. Bullish or bearish? Wearables.
Bullish. I just did some things at the Rocky Mountain National Park and just in a beautiful part of the country and with my son and he shared with me a number of steps and heart rate and a bunch of other things that he had access to that I didn't have access to. It's been really nice to know all of that. Now, the good news is for most of it, we were side by side. There were parts where he surpassed me very easily. So I can't say that, that we had the exact same physical experience, but he was able to share things with me. And I think that's a part of what we want to do moving forward. It's kind of like the monitoring of your car, without having all those monitors in place to know when something might be going bad or something might be wearing out before it actually breaks. You get the ability to go in there and maintain it and keep it healthy and well. And more of that, I think, should be coming to us within healthcare. I think we will be wanting more of that in order to allow us to be able to not only monitor and progress that we're doing what we need to do, but before something breaks, maybe something will go ahead and send a signal that allow us to say, hey, by the way, maybe you should go see this person.
Right. They're saying there's a lot of data coming out of those, but we're still not sure in healthcare exactly how to utilize it.
Yeah.
Maximize
You're exactly
that.
Right.
Yeah. Okay. Bullish or bearish? Conversational AI.
Oh, very bullish. I think that's a big piece. We're putting in a big fan of a Microsoft company called Nuance that we are deploying within hundreds of our providers today that will take a conversation and turn it into a medical note, create the billing codes, and allow us to get appropriately compensated for the service. And that's something that I think is really important. It removes some of the bureaucratic processes that happen within many industries, not only within healthcare, but allows that to take place. It's so natural for us just to have a conversation, but then to have that machine learn what really is important out of that conversation and be able to pull that out and be able to document it in our case and or take action, whether that's ordering something or making a change to somebody's care based upon the conversation that we're having. So I'm a really big fan of that.
Bullish or bearish? We're almost done. Remote patient monitoring.
Yeah, there's 2 pieces. I would say I'm bullish on that, but I'm really more bullish on hospital at home. There's a piece where, I'm monitoring you, at a home or at some setting or being able to, going back a little bit to some of the wearables or some of the things that, people will have access to, but truly moving people from a care setting of a hospital into a home environment is I think is really important for us, not only from a cost perspective, but also just from a getting healthy and well again. Being around family and friends and being in your home environment is certainly a different way for us to heal and to get better than being in a very cleansed, white, very sanitized environment within a hospital. Those different settings I think are important. And if I'm able to provide you the similar types of care and services, by you being in a more comfortable setting, not only lowers the cost, it also will improve the healing and the wellness of you as an individual. So I think that's really important. So as opposed to, or maybe in addition to remote patient monitoring, where you're still going on your daily life and I'm keeping track of you, there truly is, I think, a piece for us to transition. So when you look at some of the post-acute care services, and we saw that with the pandemic, we're still feeling it today, people that were in nursing homes and other types of post-acute type services, there's a labor shortage that's hitting them very hard as well. There's a health aspect of being maybe in those types of communities, some positive, some not so much. So if somebody has the means and the capability for us to treat them at home versus putting them into some other kind of a care setting, that would be the place for us to focus on, and really truly to have the hospital be for more of the more acute tertiary care type services and continue that transition to moving people to home.
So the last one is augmented reality.
Augmented reality, I find I'm probably just in the middle with that one. I think it's something that we still need to learn more about. I need to learn more about. I think the industry needs to learn more about. We need more applicability of augmented reality and truly seeing if we can create that type of experience. I think it's probably leaning a little bit more on the bullish side. However, I think there's a lot more for us to learn on that before I would say I'm a betting man. I'm going to put my money on it or not on it. So
I'll have you back. I'll have you back in 5 years, and then you'll place your bets when we're a bit more advanced in that. Okay, speaking of these emerging technologies, I really want to know, and I'm sure a lot of CIOs want to know what Craig Richardville thinks about this. Okay, if you had $100 billion to spend and no red tape, how would you spend it in your role?
I would spend it probably first and foremost on people, on making sure that we compensate the talent that we have here, that we can keep that talent within our industry, that we can take that talent and put it to good use, because they're the ones that really make it happen. So the things that we're talking about, whether it's the digital experience, whether it's artificial or augmented intelligence or reality, all these different things that we want to focus on, we need people in order to do that. And we need people to move themselves away from doing maybe some of the mundane tasks that we have and really focus on them doing the things that either their certifications or their licensing, things that only they can do, and have them focus on that. So I'd rather invest into people in order to make these types of changes moving forward. And then what I would do is really focus on becoming a digital company that delivers healthcare. If I was starting a new business in many other industries, would I do some of the physical plans, some of the things? Certainly there's a piece that is required for that. But there's also a legacy piece that we probably wouldn't do. So how do I transition and move myself away from the legacy aspects of how we were doing things in the past to be, if I was a new co coming in, how would I tackle it? How would an Amazon tackle it? How would a Google tackle it? Some of these companies that come in with a different perspective, I think it'd be really important to have us to not transition, but truly transform by removing those legacy pieces. And we talked a little bit about some of that, like moving people to be in the home, putting the power of the patient in their pocket with the smartphones. These types of transitions, I think, will continue, and they'll continue to accelerate. And so part of that money would be investing then into just the rethinking of how we're doing in order to move some of the maybe expensive and not value added physical plants that we have into those that are more modern and progressive, that would meet the need and exceed the needs of our certainly ever demanding and changing populations that we serve.
Nice answer. I wish I could send you the check myself, but I don't have it yet. The next big trend in healthcare IT.
I really think it's artificial intelligence. And, I think this is the piece that I'm a big fan of. We have enough data in order to create this, and artificial sometimes is not the right word. A good colleague of mine, Russ Branswell, told me that he calls it advanced intelligence. for AI, and I agree with them. I think it's not fake. It's real intelligence, and it's very advanced. And so it really is using the combination of the machine and the human in order to make decisions quicker, to make decisions more accurate, to continue to learn from when you make those decisions or when you make mistakes, so your probability factor continues to improve every time that happens. So that piece to me is probably the biggest thing I would put my money on is having it's like your GPS system. We use it so much in other parts of our life. I can't go anywhere now without my GPS. And then if there's traffic problems or something else that allows me, it reroutes me, takes me to the right place. It takes me to the fastest place. If I don't want to pay tolls, it takes me down that route. There's all these different things that it does for me. Where historically I had a map and I'd follow this map, but now that truly is that way. And you see it with Netflix and other things that you watch. It brings up to you the things that are probably you're going to like, the things that they recommend for you, because based upon your experience, it continues to learn based on your usage. And so I really think that artificial intelligence is going to be a big thing for us in healthcare.
Interesting. So, Craig, you've won many awards, many notable awards. You've led many organizations. You had your own consulting firm. You've done a lot. What is the best career advice you've been given that has helped you as a CIO and as an individual along the way?
Yeah. It goes back to one of the old things that, God gave you 2 ears and 1 mouth, really to listen, to listen to others. Don't always be the first to speak. Don't always be the loudest to speak. Certainly there may be times and places where that needs to happen, but those are typically only like in a crisis kind of a mode. And in most cases, just to listen and learn from others, you'll see people with different perspectives, different experiences, look at things, and it helps you in order to make a good decision, a great decision. Then at some point in your career, I would say you start to become kind of like in my personal life where I'm at, you become more of a parent. You're there to teach and to grow and to bring new people in and have them be better than what you are. And I see that in my children, all 3 of my boys, all surpassing me in many aspects of my life. And I'm really proud of it. And professionally the same way.
You walk into a room of 100 new CIOs entering the health system. What is something you tell them?
To be very open, to learn from other industries, to look outside of your peers, and to look at yourself first as being a leader, period, and then to be a leader in healthcare, and then to bring the CIO or the CDIO or the CDO into play. When you come in playing that card first, like, hey, I'm the CIO, the CDIO, the CDO, that's the wrong way to play. You really have to come in. That's a tool belt that you have that you've earned over a period of time and been able to add value to the table. But you got to be a leader first. You got to be a leader within healthcare first. And then you can bring a certain aspect of that, no different than maybe somebody who's the marketing or the CFO or the other members of the C-suite. There's a certain level of expertise and detail that you have that maybe they don't. And they have the same thing on you and other aspects of it. So you got to really kind of ensure that you're kind of part of the team. But when we're all focused first on leadership, then we all win.
Love it. I'm right. I'm taking notes for myself as well. Craig, who do you view as a trailblazer in the industry making an impact that you'd like to nominate as a future guest?
Yeah, there's several pieces of it. First and foremost, certainly for our industry, I think one of the leading trailblazers is my current CEO, Mark Harrison. What I've learned from him in just a short period, I've been part of his team, is just phenomenal. The way that he sees and views things, and he's very bold, and he's very knowledgeable about all aspects of the business, and to bring that into, and he's also a provider. It's just amazing how he wants to change things, the things that other people might admire within healthcare, he doesn't admire as much. And he's really focused upon, equity and focused upon changing the industry, like turning it upside down. The second one I would say is our chief strategist, Dan Liljengquist. He comes from out of industry when he gives a different perspective on things. He's not limited by maybe some of the experiences that others are. He's coming in from a very entrepreneurial, business focused, big thing focused. I think that's really fun. And then from a peer perspective, I have always admired Chris Ross out of the Mayo Clinic and Matt Cole from the Cleveland Clinic. Both of those are just great people that I would nominate as well to be on this.
Thanks again, Craig. I'll let you go about your day and hope to talk to you soon.
Well, thank you. Have a great day.
Thank you for listening to Patient Journey Pioneers, brought to you by Hyro. Subscribe to our podcast on your favorite listening platform. See you on our next episode.